some of us even more than others, by contributing to more disease, asthma, heat deaths, and mental health impact. But there are things we can do to address the climate crisis and improve the health of those we love, our families, and our communities. Today, climate and health champions join us around the table, and together we'll chart a path forward for better health for all. Welcome. I'm Dr. Kurth, President of the New York Academy of Medicine. Thank you so much for joining us today. The impact of the climate crisis, global heating, on humans and our health is becoming more and more apparent. But what about those to whom we turn for care? The climate crisis directly impacts healthcare delivery systems, whose mission is to stay open all the time and to keep people healthy through any crisis. These systems are being affected currently by financial and structural challenges, including the rising frequency of extreme weather, novel pathogens, and events like wildfires that contribute to utilization of their services. Health systems also are major contributors to carbon emissions. As much as 8.5% of total greenhouse gas emissions in the United States come from the health sector. So what can be done about this? Getting our health systems to both have lower environmental footprints, but also to be readier for the challenges ahead, including the climate crisis-related stresses. Today, I'm joined by two outstanding and road-tested climate and health champions, Dr. Robert Grossman, Chief Executive Officer of NYU Langone Health and Dean of the NYU Grossman School of Medicine, and Svetlana Lipyantsaka, Chief Executive Officer, New York City Health and Hospitals, South Brooklyn Health. Both of these guests have direct experience of how our healthcare systems must respond and adapt to a confluence of challenges, including those brought about by global heating and the climate crisis. I look forward to both of these conversations and sharing with you all. First, to discuss how healthcare systems must manage dealing with multiple crises, often in the same time, please welcome Dr. Robert Grossman. Dr. Grossman has overseen the evolution of NYU Langone Health into one of the top academic health centers in the nation. He led the historic and unprecedented initiative of providing tuition-free medical education for all current and future students in NYU Grossman School of Medicine's MD degree program. In 2004, he became the first recipient of the Outstanding Contributions in Research Award given by the Foundation of the American Society of Neuroradiology. In 2018, Dr. Grossman was named to Time Magazine's inaugural Healthcare 50 list of the 50 most influential healthcare leaders who changed the state of healthcare in America. He was elected to the American Academy of Arts and Sciences for Excellence in Leadership in 2022. He was also named a living landmark by the New York Landmarks Conservancy in 2013 for his leadership in the aftermath of Hurricane Sandy, which caused unprecedented damage to NYU Langone's facilities and required the safe evacuation of 322 patients. His pivotal leadership at NYU Langone was chronicled in former NYAM trustee William A. Hazelton's book, World Class, a story of adversity, transformation, and success at NYU Langone Health. Welcome, Dr. Grossman. It's so wonderful to have you joining us. Thank you for being here. So let's leap right in. The workforce piece continues to be a challenge for everyone, both the ability to retain and recruit new health workers coming off of such a crisis as COVID, of course, some of the burnout issues. How are you thinking about the health workforce side of the financial and human equation of running a health system?
Yeah, I think actually we have, in our institution, we've recovered. The workforce is good, it's strong, it's robust, I would say, today. Obviously, we've had inflationary pressures that we've had to deal with, like everybody else. And, New York, again, is a little more highly incented for the wage pressure and inflationary pressures, but we've dealt with it, I think, adequately. The younger generation is very interested in wellness and lifestyle, and that's separates it from the older generation. But I think both the people who work at NYU are grateful and we have an outstanding workforce that differentiates us, I think.
Well, and certainly some of the other ways in which NYU has been an exemplar in recovering from or bouncing forward, as well, was from the effects of Superstorm Sandy. So can you maybe just tell the story a little bit? I know you have before, but it's so instructive, I think, for us in the aftermath of Sandy, how NYU went about ensuring you could bounce forward and what lessons there might be for other health systems that are going to experience similar kind of challenges.
Hopefully not. So I would say, and number one, you've seen one crisis, you've seen one crisis. So, Sandy was unique because we were at the center of what was a superstorm. It was a moonless night, high tide, lowest pressure, and we ended up with 15 million gallons of contaminated water in our basement and sub-basement, which knocked out a hospital for 59 days and the emergency room for 2 years. And the question is, what happens? Yeah. And so the lessons are, number one, you have to be very visible because management has to be visible because everybody is afraid. They don't know what's next. You have to have a lot of resources to be able, because the only thing insurance does is give you the ability to sue the insurance company because they're not going to pay anything. So you have to have enough resources not to be dependent necessarily on the insurance company. You have to think long-term because the short term is very difficult. And there's a lot of pain, but you want to implement things in the long term. And, the notion that we used was we were going to make lemonade, and we were going to have lemonade projects. In the crisis, it's important for leaders to manage the managers because everybody is fearful. That in a crisis, everything may look like a disaster at the time you're doing it. So you have to, again, you have to change your focus, your frame of reference from what's present to what the future is going to be like. We actually put a stake in the ground at Sandy. We said we were going to pay everybody, regardless of the hospital being shut down or whatever, and we were guaranteeing their jobs and things like that. So that was really important to our workforce. And then we worked like the devil 7 days a week for about 9 months to micromanage everything that was going on. And I would say Sandy was different than COVID because we were the only hospital really involved with Sandy, whereas COVID, everybody was involved, and it was very, very different. But Sandy was a pretty unique experience. I think our team was hardened by Sandy, and so COVID and other sort of events like that, we were easily able to handle. The management, one thing about the management during a real catastrophe, as I said, it has to be visible, present, communicating all the time, both internally. And so what we did is morning and afternoon, we did 2 checks with everybody. throughout the entire system to make sure that everybody knew what was going on, what we were doing, why, what needed to be fixed, et cetera. So communication is very important, and leaders have to be visible. And the government is equally important, and you have to, when you have a catastrophic event, no matter how strong you are, you're going to need help from a central government. And it was, and I have to say, Senator Schumer was fantastic. He was really tremendously involved and helpful in getting FEMA here, setting up ways that FEMA would help us. So connectivity with good people in government is critical as well for catastrophes.
Yeah, we actually just had HHS Secretary Becerra here last week, and of course, talking about the Inflation Reduction Act, which Senator Schumer was quite instrumental in getting passed, which is supposed to assist health systems both with lowering some cost around prescriptions and so forth, but also in terms of that green energy transition and being readier for climate crisis related stresses. So certainly there is that role to be played by the government. I'm curious if as to other health systems learning from each other and from you and your experience, as unique as it may have been post Sandy, have other health systems kind of looked at the NYU model and experience and put some of those into their own playbooks that you're aware of?
Not really aware of it. Health systems, they all have egos. And again, you've seen one of these crises, you've seen one. But what I would say, I would add that what was interesting is we took disaster drills very seriously after Sandy. And so when COVID came, before COVID started, we did a disaster drill about an infectious agent. That was in January, before COVID really started in 2020. And what we did was, because of that, we increased our supplies to 9-month levels. So we never had supply shortages, things like that.
Interesting. So certainly the preparedness piece is relevant. There are some universal elements to that can be helpful.
Yeah, hugely important, but you got to take it seriously. We have these disaster drills once or twice a year, and we really, everybody is there, and everybody, they're incredibly serious. And before Sandy, it was just lip service.
Mm-hmm. Yeah, well, in many regards, NYU, as I say, was a great example of what to do around health system adaptation. And of course, many of us do live on coastal cities, so there's a lot of health infrastructure that can be at risk simply from extreme weather events. But I believe NYU has also been doing interesting things around mitigation and trying to sort of green up the health system, if you will. Can you speak to how you've done that, just sort of operationally?
Yeah, so FEMA was very concerned about our infrastructure being right on the East River. And so what they gave us the resources to do to have a mitigation strategy to prevent the 500-year flood. So we did all that. And we've always been very engaged in measures to prevent greenhouse gas emissions. We have a lot of green on our roofs, and we're platinum in terms of the hospital and things like that that we've done to further efforts to avoid or mitigate climate change. Do our own part.
Yeah, well, it all helps. We have a number of resources, links, and information on our NYAM website related to this discussion today. But I want to just ask you, Bob, what do you feel are 2 or 3 things that we can do and should do, as health professionals and health leaders?
Well, I think it's really important to be leaders and be able to advocate for some sanity in healthcare, and to have an opinion about what's important, what's good for healthcare, why it does matter. It really, healthcare matters to everyone, and the United States, the healthcare system, it has some of the, I think, the best healthcare, and some that's not so good. But do you throw the baby out with the bathwater, and what do you do to really enhance healthcare but not injure the best part of the United States healthcare system, which is important. People come from all over the world to have the finest healthcare, and you have to recognize that. Recognize the fact that there are tremendous breakthroughs. I think we need to advocate more for sensibility, if you would, in healthcare, and I think less irrational talk.
So certainly making the best healthcare available to as many people as possible, ensuring that it can be delivered through whatever multiplicity of crises may be forthcoming, and certainly some will, and leading that with a steady hand and a commitment to the care.
But access isn't enough. Access to poor healthcare isn't access at all. So it's about excellence.
Yes, and quality. Yeah.
The highest quality is fundamental, and poor people deserve the same quality as wealthy people.
Absolutely. I think we'll close on that. That's a wonderful motto and way of driving healthcare forward. So thank you so much, Dr. Grossman, for your time and for sharing your wisdom with us today. So we're grateful again to Dr. Grossman for sharing his insight on how health systems can think about managing multiple crises at once, in addition to the climate crisis and global heating. Now I'd like to welcome our next guest, Svetlana Lipyanskaya. Once again, she's the Chief Executive Officer, New York City Health and Hospitals, South Brooklyn Health. She's the first female to lead New York City Health and Hospitals, South Brooklyn Health as CEO. During her tenure, CEO Lipyanskaya led the execution of a facility name change and rebranding campaign, completion of a new 11-story hospital adapted for the climate crisis, and a wellness institute that reimagines and elevates the quality of primary and specialty care services offered to its patients. She is from the community and she serves the community. Her notable recognitions include Be Proud Incorporated 2021 Outstanding Women Community Appreciation Award, the 2021 and 2022 City and State Brooklyn Power 100, the 2022 Schneps Media Healthcare Hero nominee, and 2022 Becker's Hospital Review Community Health System CEOs to Know. Welcome, Svetlana, and thank you so much for joining us today. Welcome, Svetlana, and thank you so much for joining us.
What a pleasure to be here with you today, Anne. Thank you for the invitation.
Well, I want to start by just the congratulations on opening the new Ruth Bader Ginsburg Hospital. It's an amazing facility. The design of it, the way that it's adapted for the climate crisis and global heating and extreme weather, the input from your workforce as they thought about how best to make this space centered on patient care. Can you tell us a little bit about the role that the climate crisis, global heating, and extreme weather, like we had with Superstorm Sandy, played in the creation and construction of this fabulous new facility?
Sure. So we opened our Ruth Bader Ginsburg Hospital on May 7th of this year, and it was a huge event for us and a huge accomplishment. All of it, that entire building, comes out of the damage that our campus sustained during Hurricane Sandy 10 years ago. So this campus was very severely affected. We had our basement flooded. All our key infrastructure was in the basement. We had our emergency room flooded. The generators failed, so we had no power here. And we actually had to evacuate all of the patients in-house, which I'd like to point out happened safely. Every patient made it safely to another facility. Excuse me. So out of that came the understanding that we are, as we all knew, very, very close to the water. I can actually see the beach if I, squint. And so this is not going to be a standalone occurrence for us. Unfortunately, the climate is changing, so weather patterns are changing. And so we really needed to be prepared. And so through lots of advocacy, we actually received a huge grant from FEMA of $923 million. And that went to several things. One was mitigation, really getting this campus back up and open. But the majority of it went to the building of this new resilient tower, which is now called the Ruth Bader Ginsburg Hospital. And the details of it, the details of this building are really focused on resiliency and looking towards the future for how we can respond should another weather event occur. Unfortunately, it's not an if situation any longer, it's a when situation. So really everything from the flood wall that surrounds the entire campus to the different water protections at every single entrance of the building, to the fact that all of the services start on the second floor and all of our infrastructure is actually on the fifth floor, to the fact that the building is wrapped in a way so that if a projectile is coming at it, in other words, high winds, branches, it's resistant to that, right? So there were a lot of different elements that were thought of to make sure that this facility is as resilient as possible going into the future for this community.
Yeah, it's quite remarkable. And as you say, you're really future-proofing the facility. The World Bank and the World Health Organization, American Hospital Association, others have sort of laid out some principles of how we can best make our health systems more climate ready, resilient, as you noted. So what did you see as some of those key adaptations to make a more climate resilient health system? You certainly talked about some of the shifts in the infrastructure. What about the workforce itself and sort of getting our people ready for these crises that will continue to come, including novel pathogens? You all lived through COVID.
Yeah, I mean, I think we've sort of been through a lot, and this building has been through a lot with us. It was designed post-Sandy, built during COVID, and opened hopefully in this quiet period that will go on for a long time. But I think that what we've really learned is that as a workforce, we need to be incredibly flexible and very, very resilient. And I think we really learned that more through COVID than through anything else, because we really did have to adjust and on an ongoing basis. And frankly, we had to even adjust what we were building because we don't know what's coming at us in the future. And so the goal is really to be as flexible as possible, to be as nimble as possible, to be able to shift as quickly as possible. I mean, during COVID here, we put up a tent and had a second ED running. We turned every possible space into ICUs and med-surg rooms. And for our staff to be able to function in that way during a period when they were really scared. I mean, one of the things that makes this facility super special is how everybody comes together during a time of crisis. And that really showed. And so I think we learned a lot of lessons on just being adaptive. I think we don't know what the world is going to bring us, what the weather is going to bring us, what pathogens are going to come our ways. So I think just knowing that we've managed to get through COVID, managed to get through Sandy, got our patients out safely. I think knowing that gives a lot of power to our staff because they really were able to sort of rely on each other and really innovate. I think it's hard to predict. It's hard to plan for things like that. We all do our emergency management plans and our sessions and drills and all that. And all of that is incredibly important. That's true. But when you're in those situations, it never quite looks like the drill. So the ability to really to innovate and be flexible and to have a voice, I think that's the other important thing here.
Mm-hmm.
Every member of the team has valuable input, and you just don't know from what area, what part of your team the right idea is going to come from. So our folks are very vocal from every level of the organization, and I think that really helped us get through all the tough times, and I think it'll help us get through the tough times in the future as well.
Oh, that's a wonderful way of drawing from the experience and thinking about how to apply it. You know, Rebecca Solnit is a writer who's written about the environment and the climate crisis and global heating, and she's talked about how in crises people do come together. They don't always just disperse. There is some solidarity that happens, and I think that's very true with healthcare workers. But I love what you just said about you never know where the right innovation or idea will come from, and so therefore we have to support really everybody's engagement in planning and in the day-to-day operations, because the crises that are coming are multiple, right? It's climate crisis, it's financial crises, it's workforce, it's really a lot of factors that U.S. health systems and globally health systems are struggling with. So being able to cherish your workforce as a font of wisdom, I think, is a marvelous lesson. In this Around the Table series, we've been talking about the importance of telling the story and how do we best tell the story of climate adaptation, which you all have really been doing there to convince others, hospital system leaders, payers, federal, state, local decision makers, and of course, always the impacted community members, that these undertakings are of really the utmost importance. You're really one of the exemplars in having accomplished this. Are there any lessons or guidances or storytelling that you would convey to your peers and in other health systems about how to maybe think about accomplishing it?
I would just encourage places far and wide, not just ones that could see the beach from their window, to really think about climate change. I think, just like with COVID as a healthcare system, yes, we were sort of maybe mentally starting to be prepared, but I don't think anybody really saw it coming, and it affected everybody. Climate change is the same way, whether it's water like us, whether it's extreme heat that, overpowers your generators, whatever it is, it's coming, it's here. And I think it behooves all of us to really be open-minded and thoughtful about how we can create as flexible a facility and a workforce as possible, because we don't know what's really coming. We don't know how it's going to affect us, but we know it is coming. So having that, we can no longer dig our heads into the sand and expect that it will happen somewhere else, because it's not happening somewhere else. It's happening on every single one of our doorsteps. So we really need to be thoughtful about it. And honestly, that's what I would suggest most of all. This is everybody's problem now. This is not just, the shorefront's problem.
Yeah, very well put. It's here. It's affecting human health. There are things we can do, especially as health providers and health leaders. And I just want to thank you for your leadership, certainly. We have a number of resources, links, and information on our website related to this discussion today. But I want to ask you, what do you feel are 2 or 3 things that you think we can and should do?
I think that, again, we should leverage our staff. I am very fortunate to have about half of my staff live in the communities that are right around me. I don't think everybody's got that benefit, but you hear a lot from them about how you can be flexible and how you can build those systems. And I think that is the most powerful thing that we can do. So yes, of course, we should look at our infrastructure. Of course, we should, if you're in a potentially floods prone area, of course, you should lift your infrastructure above the ground level. Of course, you should put your key services above the flood waters. Those are things that I think folks know at this point, right? And if you're in a flood prone area, what I'm saying is nothing new. It's expensive. It's difficult. Not everybody has the benefit of having a large chunk of FEMA dollars come your way. Honestly, we wouldn't be here if we hadn't had to live through Sandy, but we did, right? So in a sense, I feel very lucky. I feel like, that situation has now set this community up for success in the future to have their healthcare service up and operational. But not everybody has the financial resources to do that, especially considering how challenging the financial landscape is now in healthcare and how it's likely going to remain challenging for some time to come. So the real suggestion is, what are the smaller things that you could do? How can you prepare, how to be as flexible as you can if a situation arises? How can you prepare your staff? They are your most powerful resources every single time, no matter what. Your building could fail, you could still provide healthcare as long as you have your people. And so that's really what I would suggest people focus on, is how do we really make a resilient workforce?
Thank you for that. That's a wonderful word of wisdom to focus on resilience in our workforce and for the health of everyone. Thank you so much for spending time with us today. We really appreciate it, and be well.
It was my pleasure. Thank you so much.
Thanks again to Dr. Robert Grossman and Svetlana Lipinskaya for the insightful and informative discussion on how our healthcare systems must manage and adapt to the climate crisis. Some of the key messages that we heard from both of our speakers today as takeaways: the climate crisis, global heating, is here. It isn't happening somewhere else. It isn't happening tomorrow. It's now. We're facing situations, therefore, not if, but when these crises might affect healthcare delivery. Therefore, systems have to be prepared, innovative, and adaptive without knowing the exact specifics of what tomorrow will bring. We must be open-minded and flexible as managers, leveraging the listening to all team members and employees, allowing them to have a voice. You never know where the good ideas will come from, Svetlana said. We have to advocate to our political leaders that the money is needed for health systems before the problem occurs. We must set up for success now to prepare for the future. And as leaders in health systems and communities, we must be visible, be present, and communicate at all times. Finally, philosophically, everyone deserves access to quality healthcare, and health systems need to be able to stand ready to deliver that, no matter the crisis. Thank you for taking the time to watch today. I reiterate that there is information and call to action in our resource links at the end of the program and on our website. We appreciate your engaging, educating yourself, your coworkers, your leaders, your communities, the clients with whom you work, and others. We'll be back again soon with another Around the Table as we continue our conversations with climate and health champions. Thank you, and be well.